Hi, this is Dr. Paul Goldberg of the Goldberg Clinic, and we're here today with Mr. and Mrs. Fernandez. Mr. and Mrs. Fernandez are from Toronto, Ontario in Canada, and we first saw them a couple months ago. Mrs. Fernandez came to see us with some fairly significant health problems, and the problem that Ms. Fernandez had was she had been diagnosed with ulcerative colitis. And before we talk with Ms. Fernandez today, I just want to make a few comments about this. Is a very common condition that we see with patients at the Goldberg Clinic, and it comes under the general category of inflammatory bowel disease. And it's particularly prevalent in the Western world, primarily in the United States, in Canada, Australia, and through Europe, and it's considered generally to be an autoimmune disease. Like with most chronic diseases that we see, this is a medical diagnosis, and everybody that we see who has been diagnosed with this is different reasons why they've developed it. And some people are afflicted very severely, had a great deal of incapacity in terms of their daily living habits, and many people end up in the hospital on very, very strong drugs, and oftentimes having surgery as well. And having ulcerative colitis can put a real damper on somebody's life. And you can imagine having to run to the bathroom sometimes 10, 20, 30 times a day, bleeding, disability, and there are many, many side effects that people with ulcerative colitis commonly experience, such as joint pain, muscle pain, severe fatigue, loss of appetite, and of course being wasting away like that and having all these bowel issues also significantly affects one socially. And we've seen many people with these problems over the years, and again we found every patient that has this is different. Typically when they go to a gastroenterologist, which most of our patients who have either Crohn's disease or ulcerative colitis, both of which are categorized under the title of inflammatory bowel disease, typically they're going to go on one of about a half a dozen or so medications, and those medications usually start with steroids, which are used virtually with every medical condition that involves inflammation, and usually that goes up the ranks, so to speak, and many of these patients end up being put on some type of immunosuppressant drug. One of the common ones now is actually being put on Humira or being put on Remicade, but usually it starts with some type of a steroidal application. These drugs that they go on, such as Remicade, are immunosuppressants, and they have some very nasty side effects associated with them, including immunosuppressant problems such as infection and significantly elevating the patient's risk of developing cancer. Steroids, of course, have many side effects associated with them, including demineralization of the bones, leading to osteoporosis, cataracts, thinning of the skin, mental instabilities, depression, adrenal atrophy, so the list is quite extensive. Diabetes should throw in there as well. Along Ms. Fernandez came a couple months ago, and she was having ulcerative colitis, and along with, when you had this, you were under medical care, were you not?
Yes, I was.
And you went to see a gastroenterologist?
Yes.
What did the gastroenterologist tell you in your case?
He said there's no cure for the disease, and it can be controlled. The only thing that they can do is I have to take medication lifelong, and then that will relieve the symptoms. Otherwise, there's no cure.
Okay, so you were facing. Did they say the medications would make you healthy, or they would just control the symptoms?
They'll control the symptoms.
Okay, so looking at as controlling the symptoms, and of course the drugs have side effects with them. And when you took the drugs, did the drugs do anything? Did you feel healthier when you were on the drugs?
The symptom got relieved, but I got other side effects.
What were the side effects that you experienced? Well, first of all, which medications were you on?
I was on Celofax. But prior to that, it was some medication that I don't remember the name. And I've been taking these drugs for the last 6 years.
You've been on medically prescribed drugs for ulcerative colitis for 6 years?
Yes.
Okay.
And then after that, I started developing joint pains on my elbow.
Yeah, and that, as I was mentioning, is a very common side effect with inflammatory bowel disease. Is the inflammation is not, and I think it's important to understand that these conditions are not just in the intestines, they are body-wide conditions that affect the entire person. I mean, you felt these problems other places in your body too, including do you have skin issues with these at all too?
Yes.
Yes. And that's not uncommon to have the bowel issue, to have the joint issue, and to have skin issues all at one time. Did you have fatigue at all associated with this?
Yes.
And also had fatigue?
Yeah.
Okay. So 6 years of being on drugs, medical drugs for this, and was your condition staying about the same? Was it getting better? Was it getting worse? How were you doing?
It wasn't getting better. I would say it was getting worse.
Okay. And could you share with us then, please, what happened when you came here? And you came here, it was not too long ago. What was the date? Let's see, you came here January 7th, 2013 originally, not too long ago, this year. Mm-hmm. And we placed you on, we evaluated you, we did some functional testing, we did a physical exam, we placed you on a program, and did we prescribe any drugs for you? Did we prescribe any drugs for you?
No.
No, okay. And it's been a few months later, and what is your condition currently? How much has your ulcerative colitis improved during that time?
I would say I'm 80% better.
You're 80% better?
Yes.
Okay. Now we have further goals for you, correct?
Mm-hmm.
We want to see your condition continue to improve. We want to have your joint symptoms, which some of them are still present, we want to have them get better as well. Mm-hmm. And you have one other big goal along with Mr. Fernandez, who is a willing partner in this conspiracy that you have. And what's that other goal?
We would like to have a kid.
You'd like to have a child. And so that's all the more reason to continue to improve your situation, to have good health, and create a healthy environment for that child to grow in as well. Okay. Fernandez, what have you observed with your wife during the period of time that she's been getting better with us?
I think it's the fact that she's off the medications. I think that's very important. Because when she used to take the steroids, it's just that her weight was going up. She came in from India about 3 years ago. She used to take steroids before that, if I'm not mistaken, but we just saw her weight ballooning. She also had a few miscarriages. So now, like, there's still issues because she's, like, when I take her to friends, we are on a restricted diet, but we're not on any medications. But other people who just see her realize and know that she's a lot more healthier. So that's a big plus, just the fact that she's off medication, because being on medication for 6 years and now being off medication and still controlling your symptoms is a big thing.
I think that's a very good point. It is true, a lot of our patients, a good part of helping them get well is simply to help them get to the point where they can get off some of these medications, which are, most of them are so incredibly toxic to the individual. But we have to make sure that subsequent to that, or along with that, they're getting healthier so they can get off the drugs. And once they get off the drugs, they don't have the side effects anymore, as Ms. Fernandez was on the steroids. And so that can be a very, very, very important part of them improving their health and of making the road back to good vitality and their recovery. So, Mr. and Mrs. Fernandez, I want to thank you both. We're looking forward to continuing improvement for you, Mrs. Fernandez, and hopefully having a new addition to your family in the not too distant future as well. And now that you're going to be healthier, you'll be in a much better position to accomplish that. Thank you.